Good evening and welcome to RestartED's virtual town hall, the fifth in a series of panel discussions taking place each Thursday throughout the summer. RestartED is a grassroots movement that is bringing together education stakeholders across the country to crowdsource solutions for safely reopening and operating schools in a COVID and post-COVID world. This makes each of you an integral part of the equation. We encourage you to open the chat room at the bottom of your screen and actively contribute your questions, thoughts, and solutions. Stay involved after the webinar at restarted.org and on Twitter @RestartEdTeam. And most importantly, spread the word to your peers. The more minds we have working towards solutions, the better chance we have of succeeding together. The focus of tonight's panel discussion is understanding trauma, manifestations in school-aged children. We have a distinguished group of educators and mental health experts with us this evening. So with no further delay, I'd like to introduce our panel. Bruno is the director of an evidence-based SEL program called the Social Decision Making Program, and has been working in the field of social and emotional learning for over 25 years. Currently, Aaron has been working with several schools developing and improving school culture and climate, which includes being trauma aware and creating schools where all staff and students thrive. Aaron is an instructor at the Academy of Social and Emotional Learning out of Rutgers University and the College of St. Elizabeth. She teaches courses that are part of direct instruction of social and emotional learning, credentials for teachers. Dr. Ari Kellner is a psychologist with over 15 years of clinical experience and an active psychology practice treating adults, children, and families. In addition to providing supervision and consultation to other professionals and programs, he has conducted grant-funded research on trauma prevention and written on the topics including talking to children about traumatic events. Most recently, he was the keynote speaker for the Zoom series, Treating the Front Line, which gave clinicians practical strategies to help manage first responders and healthcare workers' traumatic responses to the COVID-19 pandemic. Dr. Kellner holds a BA in psychology from Rutgers and a master's degree in psychology and a doctor of psychology in clinical psychology, both from Pace University. He completed his doctoral training at Bellevue Hospital in Manhattan and at University Hospital in Newark. Additionally, he completed postdoctoral training at Westchester Center for the Study of Psychoanalysis and Psychotherapy in White Plains, New York. He's a member of the American Psychology Association, faculty at WCSSP, and a fellow at the Institute of Coaching, McLean Hospital within Harvard Medical. Dr. Ken Silvestri is a psychotherapist and author who has worked with family-school relations for many years. He is a former teacher, school administrator, and program coordinator for the New Jersey Department of Education. His doctorate is in family cultural studies from Columbia University. In addition, Dr. Silvestri serves as a clinical professor for Daybreak University's Graduate Family Therapy Program and is a clinical assistant for family and community medicine at the New York Medical College. His website is dr.kennethsilvestri.com, and he can be followed on Twitter @drkensilvestri. Ken Mcgill is a licensed marriage and family therapy clinical fellow with the American Association of Marriage and Family Therapy for over 20 years and the president of the New Jersey Association for Marriage and Family Therapy. He is also a senior training consultation specialist in the Behavioral Health Research Training Institute at Rutgers University, serving as the Division of Children's System of Care in New Jersey. As a published author and researcher, Ken is the recipient of the Praed Foundation's Outcome Champion Award for work done to improve the quality of care for youth and families, especially in the area of increasing ways to collaborate with and empower individuals and families dealing with challenges. It's now my pleasure to turn things over to our moderator for this evening's discussion, Dr. Chuck Samson, Superintendent of the Freehold Regional High School District.
Thank you, Kevin, and thank you to all the panelists for your time and your expertise. Thank you to the members of the RestartED team for the opportunity to moderate this evening. And I would be remiss if I didn't thank Greg Tafaro, who's not with us this evening, but who moderated our first several of these virtual town halls and did a phenomenal job for us to get this started. But let's dig right into it. As schools are bracing for September and planning as earnestly as possible with an incredibly shifting landscape, I guess the first question that I'll throw out to the panel, and maybe Aaron, you can open up with this one. What should schools and school leaders be thinking about as it relates to planning to mitigate trauma in children in particular, and we'll get into staff and faculty as well later, come September? What does all that have to look like now?
Right, and that's the big question, right? So you mentioned CASEL earlier, Collaborative for Academic Social Emotional Learning. They came out with a document that actually can help facilitate that. But I think one of the things more than ever is building those relationships and those connections in that community. Our students, our teachers, our staff are going to need those connections, irregardless if we go back virtual, if we go back live, if it's a combination. So starting with understanding and building some partnerships with your staff, with your students, with your community leaders. Another piece is really making SEL a priority, and articulating that as a priority, and really creating school-based teams that can actually make that happen. I've had the luxury of working in a school district recently. It's an urban school district in New Jersey that has been hit very hard by COVID. And before the end of the year this year, we actually did some assessment of teacher and student just around perceived stress. And based on that data we got, we are now working collaboratively with staff and students to really see and develop a protocol that's going to work for that school. I think one of the challenges is it's not one size fits all. It's really going to have to be, there's going to be some frameworks we can use, but every school is going to look a little different. One of the things that came out of the research that we had done about perceived stress is control and anger were major challenges. So we're going to be working on how to give our students some sense of control and how to do some self-regulation, some mindfulness. So I really think it's going to be a group effort. Another big piece that has come up that we've been able to do that's been very helpful is to listen to our teachers, to listen to our students, to listen to our staff, to listen to our community. And then based on what we hear, do something. So not just the listening piece, but then the action piece.
Thank you. Dr. Silvestri, any thoughts on what we should be looking for as we prepare for September in terms of working in preparing for what our students are going to walk into the doors with, that the baggage that we know?
I appreciate what you just said, Aaron. This is a surreal time. The context that we're in right now is very, very trying, and it's full of uncertainty. I think that the question should be, rather than what are we rethinking or what are we restarting, it should be what are we going to revise? What are we going to revisit? There's no way that we're going to be going back to business as usual. We have a nervous system. We all know that. And it has two parts, and it's autonomic. It works automatically. And we have a calm part, which is the mindfulness part. And we also have the revved up part, the sympathetic part. As a psychologist, I've been working many years with school issues and problems, and kids are full of stress regardless. However, listen, we have this vagus nerve, which is this wonderful nerve. Everybody, it's not Las Vegas, it's Vegas. It goes from, it connects our brain to our gut, our heart. It regulates our metabolism, but it's really the nerve of compassion. And when it's challenged, and we're being challenged, it freezes. And again, since it's 95% autonomic, you get stuck there. And we get stuck in the fight or flight. and we're not supposed to save our life 24 hours a day. And I think it's really very unfair in many ways, because children, parents, community people, we're all systemically connected, to be, in a sense, in this middle of this, in many ways, politicized type of thing where, someone's saying that kids are not affected. We all hear things. We all know things that's happening. And I think that what we need to do is create not only a safe place, but emotionally and physically, the way we learn, and I think that we have to really look at, way back when I was a principal, we did a lot of things like team teaching, using the community as a resource. In New Jersey, for instance, and in most states, the states are responsible. The statutes say you have to follow proficiencies, right? So you don't necessarily have to teach them fragmented, knowledge. The world doesn't work that way. I'll finish for now because, my degree is in anthropology and psychology, and I studied with an anthropologist whose name was Gregory Bateson. Some of you might have heard of him. And one of my favorite quotes is from Gregory, and he says, "The major problems in the world are a result of the differences between how nature works and how people think it works." And I think we need to look at our curriculum, because when we deal with fragmentation, standardized testing, we're challenging teachers and their nervous system all the time. This is our opportunity, maybe to make some changes that are lasting and emotionally healthy.
Thank you, Dr. Silvestri. We agree with you, and we're really looking at ways that we can not just reimagine, but rethink, like what does the school day mean? Dr. Kellner, thoughts on the opening of school in September and anything that school district leaders and teachers should be thinking about as those young folks walk through the schoolhouse doors?
Yeah, absolutely. So first, thank you for having me, and really appreciate the kind of unique platform that you guys are putting together, where we can have kind of nuanced, deep conversations in a really kind of light and conversational manner. So I appreciate that. And, I agree with a lot of what Aaron and Ken have said. And I guess for me, a couple of points before I even answer that question. One is that as your speakers have already outlined in previous Zoom series, that we understand we're dealing with an overwhelming event, and it's affecting not only individuals, but systems. And I think that can feel quite overwhelming and deflating. But for me, this is a real opportunity. It's an opportunity for us to build resilience in our kids. As Aaron alluded to, there's a lot of programs out there that are already happening. Social emotional learning is something that we have already. The language we have already is out there. And so I really believe that if we have the proper mindset going into the fall, we can take this as an opportunity to help our kids build those skills that we've been discussing in social emotional learning. Mark Brack at the Yale Study Center, certainly a lot of what Ken is talking about, all of the neurobiology we understand. We've never known more about trauma and trauma prevention than we do today. So there's a lot of things that we can do, and I certainly would like to get into those. But what I'd like to share with the group and even ask people to think about is one definition of trauma that I often work with is this idea that the absence of emotional attunement from your surrounding relationships is what causes the inability to take a intense event, COVID-19, the pandemic, and integrate that and make sense of that. So for me, relationship, as Aaron highlighted and Ken alluded to, is really the key. And so one thing I want to talk about is the thing that I can think of that is closest to this was 9/11. And what we saw there was a real delay. We did not see traumatic stress and PTSD, and we really expected people to potentially be reporting all kinds of post-traumatic stress disorder symptoms. And what we saw was a lot of behavior problems, a lot of alcoholism, domestic violence, all kinds of behaviors, but people were not coming in. And so I don't expect our kids to come in with PTSD or even traumatic stress. I expect there to be a lot of kids who are resilient, but a lot of kids who are going to be coming in potentially having behavior problems and or needing a place to kind of in relationship process these events.
So some real complex phenomena there, and I think as school leaders, we're certainly used to dealing in trauma, but it's partitioned up, right? It's not as everybody's coming into the schoolhouse having experienced this, and so navigating that. Ken, I'll ask you. You know, what can we do to prepare our staff to work with the students? And so I've heard relationships, resilience, that this may be delayed. And we all know, and in speaking in our own surveys and in speaking with our faculty and staff, you know, they've been impacted, obviously, just like the students have, yet they're going to be responsible, right, to really shepherd the students as they come through those doors in September. And so, Ken, I'll open with you, just asking, what should we be doing for our faculty and staff at this point in time?
Absolutely. Well, thank you for being, you know, allowing me to be part of this. And I guess I'm going to be called the other Ken, which is a great thing to happen. I agree with everyone so far that's mentioned. There's just so many different prongs to this, and having a multi-prong approach. I think the one thing that we can do when we think about the teachers, educators, remind ourselves that these are individuals who, like you said, are impacted as well by this systemic, interfunctional, traumatic event that's worldwide. I heard something today that was interesting. So when you asked me that question, I'm responding to this afternoon a webinar that I attended, and someone said we're all in the same boat. And so my response to that would your question would be to the response that I heard about this, that everyone being in the same boat. We're not in the same boat. We're actually, if we think about defining and starting to move forward, let's all agree that we're in the same storm. The actual boats that we're all in are individual experiences. So teachers who were home during this process, they might have also been parents who were dealing with their children, as well as all the other life components. If we recognize that we're all in different boats, let's recognize also that we're all in different size boats. So some people are very fortunate to have large boats that we consider a yacht, able to motorize over to every aspect where they need to move towards. There are some with smaller, but still have the means to navigate through all the things. So if I'm a teacher and I had internet, I had my job still, I was able financially to do this, and this, and not dealing with larger issues of poverty and other things. But we really have to recognize that there have been some impacted, including, again, all the folks throughout New Jersey and beyond, that were in small boats, that were in actually small boats with many people, some of which didn't even have oars to navigate anything. So when you think about this, when I thought about we're all in the same boat, that's not true. And we're in this storm, and each of us need to recognize, but especially the educators, because they tried their hardest. In my small school district, where my son is a sophomore, and he was a freshman moving into sophomore year, and my granddaughter, who was in second grade, the school teachers that I saw tried everything within their power to do whatever they can. But after having many conversations with them, they were just barely keeping their heads afloat with all that they had to deal with. So if we first recognize that this has truly been an amazing experience, some of which was negative, some of which was positive, that's a start. So I don't know if that's the best answer. The storm in my, or the boat in my head was needed to be talked about. We're in the same storm, not in the same boat.
Can I jump in? Is that okay?
Absolutely.
So one of the things that we talk about is this idea that if we don't feed our teachers, they're going to eat our students. We have to start with the teachers. They need to be equipped with SEL skills or emotional regulation skills and self-care skills. Their voice needs to be heard. Their concerns need to be addressed. They need to be part of the process. And that's where we really need to start, is making them part of the process, hearing their voice, making them part of the decision-making, giving them the skills that they need, helping them with their SEL, having empathy and resilience for them. That the teachers are where we need to start in terms of this. It really is about creating that climate, that culture and that climate of connection, healing, and resilience. And the only way we're going to be able to do that is if we do start with the teachers and giving them the PD and the voice and choice that they need to be able to operationalize this huge task we're going to ask them to do.
Yeah, I agree in many ways. It's, relationships are so important. And, it takes two to know one. If we have relationships that are competitive, we're not going to work anywhere. I mean, we can't just be partners. We have to be collaborators. But I think that children and parents all have wonderful input in this whole thing if we look at it holistically. And I think that the more we talk about the quality of relationships, the mutual learning, like for instance, with this whole thing with COVID, we were so unprepared in the hospitals. But what's coming out of that, the research is actually, it's really in the present, in the moment, where doctors are talking to each other. So teachers have to start talking to each other, parents have to start talking, and then we have to start talking to each other to create a context, an environment, that allows for improvisation, different, transitional things. And still doing and keeping rigor and all the wonderful skills that we've had. But again, it's business as usual is just not going to work. It's time to really empower all of us that work together, including community people.
Yeah, I see some folks are dropping in the chat that, time is running out and, September is almost upon us. In many parts of the state, we're opening up in mid-August. Here in New Jersey, our plans are due by the first week in August. And so we are certainly in a boat in a storm. And Ken, I'm going to steal that from you. I love that analogy. But Dr. Kellner, any thoughts on what we can do now to prepare staff for what this looks like? That seems to be on everybody's mind in the chat room.
So in the chat room, it seems clear that people want some actionable pieces right now, both in terms of training and what to do. And I'll just relay that certainly in some of the school districts that I've been talking with, this idea of having a homeroom every day with that. So I think one of the first things you need to do is figure out where in your district you're going to create space for relationship and connection and give teachers space to do some of that SEL work. And one option, and I know that there's a lot of different needs and a lot of different ways to go about it, but one option is to have something like a homeroom, right? And then what is a teacher going to be doing in there? Now, I have a couple of PDFs that I'd love to have dropped in the chat room, and one of them is the Connecticut Trauma Scale. It is a great scale that I think is specifically designed for non-clinical personnel, and in particular school personnel. It's really short. It's 10 questions. It looks both at events and then it looks at children's reactions. And I think it's a great tool for teachers to scan and think about both. They can use it for the individual, but they can think about using the scale to just kind of create an atmosphere where we can talk about these things. And then you can begin to identify children who are coming up high on this, and then begin to bring in your school clinicians. Because I think that there's no way that most school districts are going to be able to use their clinicians to be available to all these kids. I think a lot of kids are going to need a lot of support in talking about things. But again, I want to highlight that a lot of our kids' baseline is really healthy. And if we give them the atmosphere, if the teachers feel comfortable in creating a space to talk about these things, a lot of kids are going to be able to integrate these pretty intense experiences and storms, as Ken is referring to.
Some of the concrete ways we can actually do this is to say that when you left school, you didn't wear a mask. So putting this on, and some of the things you can talk about now, what are some of the things that this mask represents when they have to go outside and being told by our governor, which is for, health purposes, absolutely. But you can't see if I'm smiling. You can't see if I'm frowning. You can't even see anything. And that's what kids are not going to be used to. So I was thinking in terms of some of the ways, this is going to be something we're going to have to use. This is going to be like a paper, pencil, notebook, part of your backpack. And then my son actually asked, Dad, how do I use this? Which is going to be down at the nurse's office. making it okay to talk about, well, if I go down to the nurse's office, he said, to use my inhaler. By the way, this is one, it's empty. He has this, still has this one he uses. But if I go down there and I'm seen at the nurse's office, will I be labeled as someone who has COVID? Will I be seen as? So really helping to have those conversations that it is certainly okay to see the nurse. It's okay to talk to the guidance counselor, to the teachers, and those conversations need to happen now. And they're going to be happening more and more behind these. So the more that we can make it open and honest, and you're absolutely right, all the assessments and giving a lot of resources. The National Child Traumatic Stress Network has a lot of resources out there. But I think the more tangible we can become. So my second grader, my granddaughter, is saying, what's this going to look like when I go to school next year or this year?
So Ken, you are the first panelist to bring props to our webinar. So I want to commend you on that. Yeah. So let's talk a little bit, obviously, in the midst of the COVID-19 crisis, tremendous racial unrest across the country. Schools have struggled in many instances with students of color and raising their voices in profound ways to really unearth what is happening, the systemic structures in the school. How do we as educational leaders, when we're looking towards September, what can we do to raise our student voices and to make sure that we are creating avenues for help, for success for all students, not just some students, but for all students? How do we engage in that work? Aaron, I'll start. Go ahead, Aaron. I'm sorry.
There was somebody, no. So one of the things in terms of equity and SEL and then how do we increase youth voice? Again, I sound like a broken record, I get a little bit, but it really is about increasing teachers' SEL and understanding, having their own self-awareness and understanding their own implicit biases, right? And understanding their sort of views on things. And then creating those opportunities for youth leadership across the board, not just the smart kid or not just the good kid, but all kids, giving opportunities for leadership is incredible. And some of the greatest experiences I've had in schools has been working with those quote unquote at-risk youth and empowering them to be part of the community, and having them feel as if they're connected in a positive way has been an amazing situation. So what we did was we had at lunchtime, we created a group of 8th graders who were quote unquote the at-risk youth, and we gave them some training on how to do some peer mediation, and they worked with some of the 3rd graders, and it just increased and empowered them, increased their voice. And we saw the climate shift, we saw the culture shift, and we saw a lot of really great things, suspensions, detentions decreasing across the board. So finding those opportunities.
Dr. Silvestri, any thoughts on how we elevate student voice in all of this?
Yeah, I mean, this pandemic has created a different world, and there's a collective consciousness, I think, of things, from historical monuments and many things that we've been taught, that have overridden and was not exactly, sensitive to the actual narratives of what's been going on in our society. So again, I mean, I don't want to be redundant, but if kids are going to come back to the same old, thing about, having competitive testing and fragmented, periods with different subjects, I think it's going to be very important that these things go across the board, or what I call trans-contextual. We have to all see how everything relates. So your current events is going to be a little bit different, but it's not only going to be different, it's like a hologram. Each part is part of the whole, and each kid has a new story, a new narrative. We've been challenged, and our paradigm has changed. And I think it's so important. We have these skills. We know how the body works. We know a lot about the neurological system. We're learning more each day. But it really comes down to allowing our kids to be working with transgenerational. There's a lot to be learned out there, from our seniors, from our community people. There's a lot of people out there who don't have children, who complain about, voting and funding, school board budgets. this is the opportunity to really break down the walls in many ways. And yes, safety comes first. We really have to be sure that we're going to have, the ventilation and all the things that, parents are, I think I just heard on the news just before that something like 65 to 70% of parents are really apprehensive about sending their kids to school in September, period. So we don't have a whole lot of time, but we really do need to say what's going to be the context. Are we going to just bring kids back into a situation where it's going to challenge their sympathetic nervous system even more? Or are we going to really be able to give voice? And going back to voices, to break down the barriers of discrimination. There's a lot of different changes going on right now.
Yeah, and as a school superintendent, I certainly hope that as leaders, conceptualize reopening, that students are an integral part of that planning.
Mm-hmm.
You have to be running focus groups. You have to be talking to kids about what this experience means for them, and that has to be factored into your planning, certainly. Ken, any thoughts?
It's like a new curriculum in a way, in many ways.
And there's some real opportunities here. Even something as on surface, difficult as wearing masks, right? But you could rethink your school day around, well, if you have to provide mask breaks, right? If kids are supposed to wear masks and we can't fathom putting them on all day. So how do you reimagine your entire school day, right? And you work backwards from there. And I do think there are opportunities for schools, and then that maybe that time is integrated with SEL. I know we've challenged our principals to rethink the entire school day from start to finish, and to get at the mental health of faculty, staff, and students, right? Like everyone who's in the schoolhouse.
So I just want to jump in and say the big elephant in the room then is, how do we do that along with all the performance demands that we have academically? Where are we going to find the time? The kids are already, and the teachers are already so burdened with content and performance. And as many people have talked about, there's a real opportunity to maybe break that system and reinvent ourselves here. And I really would like to talk about the idea that it seems like we're all in agreement, and that's great, but like what happens in the first month or two? Maybe we create a little more space, but then do we get rocking and rolling here and everyone's now focused on content and grades and performance, and this all moves to the background? Because it's not going to be over in the first 2 weeks. And our culture is not one in which there's a lot of space for SEL or mental health. It's really a content performance-based culture. So I'd love to hear what the superintendent thinks. I'd love to hear what the panelists think. I'd love to hear what some of our guests are thinking about that, but I'm very concerned about that.
Yeah, and rightfully so. So just something to think about, grading, right? Grading, and we've talked about this over and over again. Everybody jumped off of the traditional grading scale. Most folks did at the end of the year because it's a pandemic, and so it went from this competitive, I've got my grade, others can't get. And I was, it was a difficult row with parents who fought back, saying, well, what if this child isn't working as hard as mine, and they may get an A, and what does that mean? And so somewhere along the line, we have to get back to learning and not content dumping, right? And so this is an opportunity to get off of that. What I would hope is that the families, professionals, faculty, and staff have seen that you can chunk your curriculum in a way to still deliver content in a way that students can really make sense of without it being overload. And I think perhaps there's opportunity here come September to get off that competitive dogma that just drives public schooling. And so, but we have to be earnest, and it has to be more than webinars like this where we all seem to be in agreement, right? How do we plan for that? And I think the way that we plan for that is that we support our faculty and staff in understanding all the nuances of this and how that contributes to healthier kids, right?
Right.
Yeah.
And the other piece of it is it's not SEL or content, it's both. And without the SEL, it doesn't matter what content you have, they're not gonna learn it. So I saw actually somebody put it in a chat, and we talk about it in some of the trainings I've done. SEL is not another thing on the plate. It is the plate, right? It's the foundation. It's learning is interconnected to the brain. And if we're emotionally distressed, we're not gonna learn. So it's not either or, it's both.
And what I was going to say is that there's an amazing blog that everyone on this panel and all the attendees it can contribute to in terms of ideas. For example, we can look back at the last quarter where this pandemic occurred in March. April through June is the last quarter of the school term. So wouldn't that be great if we can take that data and look at school attendance and academic achievement, whatever that looks like, for the 3 semesters, and then do something where if we need to triage, there's a structure that's national. The INRS, not the child study team, but a structure that is national that can actually do some triaging. And the students who were students that did fairly well and then dropped off the radar, they could begin to start saying, well, why did they drop off the radar? Without punitively saying, well, you didn't bring your grade up to your A level. We can actually begin conversations of why did that happen? Because all it's going to look at for that last semester, that last term, is what occurred, period. We don't know about the why. We don't know. So isn't it great where I'm seeing all the resources that are being put in there, all the people's discussion about ideas. If we're coming together and structure this, we can accomplish so much while also reimagining the educational system and how we teach. We're not teaching towards testing. We're not teaching towards grades. We're teaching towards knowledge, which embeds all the things that were discussed by all the folks here on this panel. And by the way, people are very fast typists, but the information that they're sharing is amazing. So at the end, thinking about the INRS as a triage, specifically tangible, to work with the students who really were struggling during that last semester, and then reimagining all the wonderful things that can happen with our educational system.
So I've seen some posts in the chat, and I saw Dr. Kim from Pure Ed's posted, College Board, and ACT and SATs and the such were, obviously not required this year. State standardized testing didn't occur, and guess what? The world moved on, and I think that's certainly a start, but that doesn't, how that manifests itself back into the culture and how we as educators choose to utilize or not those tools and speak out when we can and build systems that aren't reliant on standardized assessments as the outcome of what our children are. It's incumbent on us, right? And so I think we do have a real opportunity here, but we have to collectively raise our voices to that opportunity. And I think I would be remiss, and I've seen another number of posts in the chat room where folks are talking about, this sounds wonderful for some students, but the digital divide is real. In New York, we had in New Jersey, we had about 90,000 students that were not connected to the internet. Through all this, across the country, it's unbelievable the number of kids that were not connected and still aren't connected. And so advocating for that is critical as well. And we know we have some flexibility here. Most schools are working on hybrid schedules right now, assuming some sort of inability to fully return to the schoolhouse. There's real opportunity there, right? As well. As bad as it may be, there's some tremendous opportunity there to make some bold changes.
I agree. I mean, I mentioned nature before. Nature works in very interdependent ways. And I think that if we emphasize interdependency, where mutual learning, even with kids learning from each other and from the community, then it's a different context for evaluation. In many ways, the standardized tests, the SATs, they're very antiquated, as are most of your IQ tests, et cetera. And as we start opening up our society to such individualized, manifestations, we then become collectively interdependent. And there's different ways to evaluate that. And I think as educators, we need to be able to advocate for that, so our kids aren't just slots and numbers, and we have to get away from that. Talking about trauma, that's traumatizing.
Yeah, And the difficulty there, right, is we have to raise our voices in unison in this. I think that we all know the importance of SEL moving forward. I think it has been traditionally in many places marginalized at the expense of, to what Ari had stated earlier, content-driven curriculum. There's real opportunity now, but only if we come together and in unison and really utilize our platforms, for such changes. Because I'm fearful already. Nothing has changed about seat time requirements. The minutes that are required per classes are all still the same. And I think when we all move into our roles as professionals, nobody says, you know what, Chuck, for today, you need to work on this for 47 minutes. And then please work on this other thing for 47 minutes, and away we go. And so challenging the status quo, I think, is sort of laid bare at our feet. I'm interested from the panel in, what are some practical things, so I have a group of 900 teachers returning. What can I specifically, what is my message to them in September? Like what can I literally do? Step 1, 2, and 3 now, like take action with not just SEL talk, but what do I need to do to help those 900 teachers?
Well, it's not just SEL talk, it's SEL practice, right? So practicing what you preach. So it really is, and I'm sorry, I just jumped, but it really is about operationalizing the talk. So if we are going to make SEL a priority, we get a group of teachers together. We listen to their concerns, we develop a plan, we look at what content, we give them the skills for themselves, but also how to teach. If we're going to be doing virtual learning, we are aware that not everybody is well versed in this, and we get a group of teachers together who can learn from each other and how to make virtual lessons more engaging. If they're having challenges with students who aren't getting online, we're working together and articulating and trying to find out why. We connect every adult with, we connect every student with at least one adult who has the ability to check in on them to make sure that they have one adult that they know that they can count on. We equip our teachers with the skills that they're going to need to not just do the SEL skills, but to embed it into the culture, into the climate. We also give them help them with their own self-care. One of the school districts I worked in, what we do is we actually, we call it a teacher happy hour, but alcohol is not involved, but it is the opportunity for teachers, because this has been a high stress time for everybody. And it's just an opportunity for them to come together. What's working, what's not, what do you need? How can I help?
So it sounds like, Erin, that you're talking about cohorts like they're talking about with students. You can actually apply to the teachers. You can actually apply it to the school districts, schools within that school district. That's the systemic way of thinking. That's the way we can all come together. And can you imagine if we're doing this in New Jersey and then we go over to our neighbors in New York, Connecticut, or now that it's all virtual, we can go to our neighbors in Washington State. We can go to our neighbors out in Idaho. And that's how, I love that with the cohort model.
And actually, even a success we had is we were working with some teachers kind of trying to do this cohort model. And we had a group of parents who didn't know how to help support their student with the online learning. So I have a youth group in one of my school districts that they actually designed a model for a book for parents who could then be walked through how to use the technology for their students. And they did it in both English and in Spanish. Go ahead.
Chuck, I just wanted to, first of all, I really appreciate your systemic outlook. I haven't met many superintendents that have that kind of outlook. I mean, a lot of superintendents are forced into a very linear way of looking at things and are evaluated on a lot of content. But you mentioned, like, what could you do immediately? And, I really think that we have to do some mindfulness. It was mentioned before, right off the bat, a lot of empathy, a lot of breathing. It doesn't take that long, but it goes a long way. I do what they call coherent breathing, which is 6 seconds in, 6 seconds out. It soothes the nervous system. We have to soothe not only our nervous system, which is part of the context of who we are, but it also carries over to family and community. And I think teachers have to start there. We can't do everything at once, but you know what? allowing a real mindful approach, looking at things systemically, following leadership like yours. And you'll see kids will fall into place, community falls into place, because it is more in tune to what nature's about. The institutional psychology of schools has really put bureaucracy and content first for far, far too long. I've looked at a lot of innovations. I did my dissertation on how innovative programs fail in schools because of double binds. Yes, we could do it, but we can't. And we have to start being mindful, and that's the basis of who we are. That's what nature is about. That the structure will follow, the context follows, and I think we have to trust that as humans, we have the potential, to really stop, talk, and start rebuilding. Entropy means everything falls apart, but new order comes. We're at that stage. I mean, to go back to business as usual, it's just would be horrible and more traumatic. It'd be like post-traumatic non-interruptus.
A terrific point to what you just said, Dr. Silvestri. So we were discussing what's the matter with the classroom on 30-minute intervals, getting up and taking a walking break, right?
Yeah.
And refreshing their mind. And right away, there was pushback. Folks said, that's a security issue. How are we managing that? Who's going at? So all those structural impediments and that the mindset of the institution rained down on that quickly. And so that's what's going to happen across the country as folks attempt to innovate to answer this new normal moving forward. And I think we have to just push through. We have to push through, and we have to have the courage of our convictions. I saw in the chat room, Ari just said we have to model, right? And so I think we do have to model that for our adults. I want to pivot just a little bit because one group we haven't really discussed, although Aaron was really getting at it a little bit a couple minutes ago, are our parents in all of this. So we're rethinking what school might look like. We're trying to support the trauma in our students and our staff, and we're communicating all this. How do we bring our parents into the fold of that because everybody went to school, and they all have their experiences. This is what I expect from the schoolhouse. So how do we work with our parent community to really embolden them to push for positive mental health change for students?
Chuck, I think that, again, it's a modeling what we are asking our students to eventually do. And as Ken talked about, this interconnectedness, and I think you're right to bring up families, because certainly they are the ones who are also feeling the impact of these things. So I personally believe that whether it's through virtual or in person, the biggest loss that we've experienced is our ability to kind of socialize together, our ability to be together and to connect. And so we need to create spaces, and I think we need to do it now, not in September, where people are asked to come and discuss these things. I think there'll be lots of varied opinions, and it's an opportunity to educate people on SEL. But again, I also think we need to have space for teachers to do that. And one of the things that's important to remember is that in our race to kind of want things to be normal again, which again, all of us here understand aren't going to be, we can tend to want to have a normal day or avoid these topics. And I think what is important is for us to push that, when we meet, we're going to talk about your reactions to this, your feelings about this. And we need to do that with parents. We need to do that with teachers. I certainly know of a couple school districts who kind of offered some venues to talk about things, but left it optional for teachers to join. Very low attendance. They shifted and said, you guys got to check in at least twice. They checked in, and boom, as Ken said, it naturally will happen if you create the space for it. So I think we have not been able to create the space yet for parents, and we need to do that.
I think parents are your number one advocates. They love their kids. And, when I used to work with the schools, I made sure the parents always got a copy of what the school boards offers, everything a parent should know about public policy. It's not that complicated, but most parents don't understand. They don't understand how proficiencies and curriculum could change, or the rights that parents have in New Jersey, for instance. It's amazing. but not in a competitive way. You know, being partners doesn't always work. You know, it's like the pig and the chicken doing a ham and egg sandwich. It just does not work. But collaborating is different. You know, it's very different. And when parents really could collaborate and understand, you know, in clear language as well as with teachers, you become collaborators. I mean, any good teacher wants to have support by the parents. Let's face it, you know, and that's the kind of thing I think that we have to work towards, you know, mutual advocacy to make changes, you know, and to be somewhat radical in that.
I would just add though that, you know, certainly as a parent, I've gotten a lot of surveys and things, and that doesn't foster a relationship for me. It certainly is great data collection, and I think it's important. But I need to connect with other parents. I need to connect with my school staff, and I need to be in relationship with them. And in that, I can start to heal, they can start to heal, and we can start to relate again, because I miss them. They need me. I need them, and we feel really disconnected from each other.
That's a terrific point, Ari, and you're making me feel badly about all the surveys I've sent out over the past couple of weeks.
Yeah, there's too many of those.
Well, and you know, as a parent myself, everybody's getting survey after survey after survey because, you know, you need the baseline data, but thinking about the ways to connect through that. One of the things we did today, you know, we put a survey out today, and we probably had 20 or so parents email questions about the survey. And so we made sure that there was an extended phone conversation about the survey itself with each one of those parents. And then we actually modified our survey in real time from those parents who were giving us feedback as it was iterating, you know. And so I think you can't ever forget that the need to connect to everyone. And we do need our data. We need to understand, you know, what does this look like, and how many kids aren't going to come back no matter what, and what does that look like? And so, you know, we're one emergent theme I saw in the chat room too was any thoughts around how we engage families from different cultures, ESL students that may not, you know, obviously not English as first language, parents, there might be language barriers, cultural barriers, and the such. And any thoughts from the panel on how we would engage those groups in this work?
I think we can also use cohorts. I mean, there's some families who might be completely familiar with many cultures, their own included, and could lead this conversation. And if language is a, we really should have the people leading conversations who are able to speak, understand, and respect all cultures. And so I just have in my head today, beyond the boat and my my props, the fact that cohorts can also be for adults and teachers, parents, educators. And wouldn't it be great if we can actually combine cohorts to mix them? And so if someone is very familiar with a certain culture, understands there's certain things that cultures might expect, like respecting educators and saying, well, you're the experts in this. Why are you asking me how to educate my child? And having dialogue saying that, you know your child best, where I might know education, and having an open dialogue of
and I think
getting back to my 3.5 cents.
I'm sorry. You know, getting back into getting parent liaisons again to really work with the community, celebrating from different food, different ethnicities, different cultures, having people interface and getting to know each other. You know, it's not just integration. Again, it's interdependency coming together, and I don't see a whole lot of that, but I think that's going to be something that's going to be very important.
And one of the
especially with the healing, our country has a lot of healing to do in terms of disrespecting, devaluing.
And one of the things that we found was helpful too is if we actually engage the students to do some sort of presentation, either around SEL or around something, and if the students are a diverse group, and then their parents are going to come, especially for some of the older students who, you know, when you're in elementary school, you go to all the stuff, but when you're in middle and high school, you don't go. We found a lot of connection that way by inviting our parents to come see their students and then engage them while they were in the audience.
Yeah, just understanding each other, you know, what I used to do a lot, and I know Ken can understand this, we come from the same lineage, doing genograms, family genograms, and sharing it amongst people, and then putting guts to it, whether it's, again, bringing food in or celebrations. And that just ties, it really gels the community together. And then learning is accelerated. It's just accelerated. Skills just move along when you start doing things like that.
I love it. The chat room is now taking Ken's boat analogy and building it up. We need different life jackets for folks who are further away. Phenomenal. So we've got a little thing that might be going viral here.
Well, and Maurice Elias would say, we all have to row at the same time too, because if we all row in different directions, we'll just go in a circle.
In and around. Yep. So the hour moves very, very quickly, and I'd like to just offer an opportunity for each of our panelists to give us some closing thoughts on what all this means as we trudge forward to September and reopening here in late August in some places across the country. And Ken, you knocked it out of the park with the boat reference, so I'll start with you.
Okay, I'm going to get back on the land for a moment. I think in terms of what we really can do is to make sure we remember that kids thought of school as a safe place. And if we can make an honest effort of creating safety, physical safety, psychological safety, an open door, open window, open safe distance, the conversations, we'll do fine. I think kids, like Ari was saying, they're resilient, and let's build on resilience. Let's talk about, connecting it all together.
Dr. Silvestri?
Well, I think, briefly, just get away from this, competition and being non-connected. And I think the theme is to look at things more holistically as we are interdependent. And I think if everybody, adheres to that, it's very contagious. And it's how nature works anyhow. And so it'll be a wonderful experience. But I think we need to change our framework on what it is, the larger framework of what schooling is all about and learning.
Ari, closing thoughts?
Just that I'm excited after this conversation, listening to you talk about the idea that we need to all come together to raise up our voices around kind of breaking this old content pushed system, and looking at the chat and how many bright, intelligent people are out there talking about kind of the same thing. We're all on the same page here. And I do think that if we create some safe space, there's a lot of need that will come together about this, and I really do believe that there's a real opportunity here. I'm really hopeful.
Erin?
I'll just say SEL is the plate, the foundation, I think, for building the connections and creating the healing. And I also want to say that I think in these conversations, we tend to not realize how much strength and resilience we do have, and building on that. And I do have I have high hopes for the future. Actually, I am very excited that things can change for the better.
I share your optimism. We came together and RestartED as a group of folks just struggling through this, and found strength through each other, and decided to say, hey, how can we just build this out? And so we're going to continue with these conversations. We've got another one next Thursday, July 16th, with a bunch of very well-known board attorneys who are going to talk about some of the legal ramifications of all of this, because that, getting back to the business of making sure that we do the right thing, we do the safe thing, we do the legal thing, and we follow all the appropriate guidelines is critical as well. But I want to thank all the panelists tonight. It was a phenomenal conversation. I feel very good about the fact that people are looking in different directions as a result of a very terrible situation. And now the real work begins, right? To continue down some pathways that we dipped our toes in, in a lot of ways, but haven't really taken that step in some other cases. We have to really, we have to take those steps, and we can only do that together. So thank you to all the panelists. Thank you for everyone who attended the webinar. The chat room was phenomenal. Everybody, you can save the chats on your own Zoom link. So save them. There's tons of resources in there. And I wish everyone a wonderful summer. and all the best to you. Thank you.
Thank you
Bye.
very much. Thank you.